When was the last time you went to the doctor and talked about your penis or talked about your sexual health in general? Chances are it has been a minute or possibly even eek, never. In this episode, we are going to give you the doctor's visit you want to have but haven't booked on your calendar. Welcome back to The Naked Connection. This is the show that supports driven men to reach sexual mastery and build deep connections. It's Kirsten, and before we get any further, please take a moment and hit that subscribe button so that you don't miss a single episode. Today, I have Dr. Paul Gittens here. He is one of the leading sexual medicine physicians in the country, and he is going to answer the questions you don't want to ask. What can I do about my weak erections? How do I balance my testosterone levels? What should I do to improve my erection health? Maybe I come too fast and I don't know what to do, or I can't seem to ever come and I don't know what to do. We even talk about your prostate and what to look for if you're on weight loss drugs like Ozempic. This is a really science-packed medical insight into your sexual wellness. Welcome to the doctor's office. We'll be with you shortly. And let's get some. Dr. Paul Gittens, welcome to The Naked Connection. Happy to have you here today for this special episode.
Oh, thanks for having me on this wonderful show. I hope a lot of your listeners will, get some tidbits out of it they can use in their everyday life.
Yeah, amazing. Well, in thinking about that, what can they get out of it? One of the questions I wanted to start off with is, in understanding you are really one of the leading sexual medicine physicians in this country, and you see patients every day who have most likely postponed some kind of concern and haven't addressed it until it's become more serious. And I'm wondering what has been one of the most prominent issues, especially in this space of sexual health, that you've seen men avoid discussing, but should really bring up sooner rather than later with their doctor. And what can they, and maybe perhaps even like from your perspective, what prevents them from having that conversation or making that appointment?
Men, when they come in, some guys have waited 2 years, some guys have waited 5 years. I had a guy today that had ED for 13 years, and he finally said, "Listen, like I've tried all these things and nothing's working. I want to know what's going on with me. I want to know why I'm having these problems."
Mhm.
And so it does take a lot for a guy to recognize that they're having problems and then to take it a step further to search for help. Globally, these problems are really the same, and I think guys need to understand that it's not just happening to them. Like globally, no matter where you are, like these problems that are happening to guys are always are happening to all guys,
Yeah.
and for the most part, there's some really common sexual problems that men have. The most common thing is like premature ejaculation. That's really common. That affects probably like 30% of guys. There's erectile difficulties, and I like to say erectile difficulties. I try to not to say erectile dysfunction because it's not really dysfunction. I mean, a lot of guys are having difficult time having intercourse, maybe with like the initiation or the maintenance of their erections. And it's a broad spectrum of things that could be going on, as well as there's a broad spectrum of issues you can have with your penis, right? You may be able to start and not finish. You may be able to, kind of go through things like have intercourse, penetrate, then it goes down, then it might stutter. There's so many things that can happen to the penis. Outside of premature ejaculation and erectile dysfunction, there's guys that have low libido and they may have low testosterone or may have other things. Everybody thinks that low testosterone is always the cause for low libido or that it's only cause of erectile dysfunction, but there's so many other reasons why guys can have these issues. So there's a host of things. I see a number of men that may have pain with intercourse or issues with delayed ejaculation where they're taking too long to ejaculate. It's like 20, 30, 40 minutes and they're like, "Oh my God, I'm getting so tired here." And then their partner's frustrated, they're frustrated. So there's a number of things that we see in my world, but one of the most common threads is that guys don't like to come in when they have a problem in general. They just don't, you know. And sometimes they need to be pushed by maybe a podcast like yours where, you're giving them all this great information. Sometimes it's their partner that's saying, "Hey, listen, like you got an issue. Like we got to get this solved." Sometimes it's when they're coming in, it's because they just broke up with someone, and that breakup was because they didn't address their sexual problem. So it really depends on the person. It depends on the relationship. It depends on how what's going on in their life. Sometimes they push it aside. Like for instance, today we had a guy that he had a number of he's had ED and he's had premature ejaculation for a long time, but he's had kids, and then like he was going through a divorce, and it was just no time to like address it. So for him, it took a little longer than I think it would have taken me if I was having those issues.
Yeah. Okay. So you just kind of laid out a handful of
I know I wanted to
potential.
get your wheels spinning here.
Yeah, yeah, yeah. And there's a handful of different possible dilemmas that a man might face at some point in their life. And I appreciate that you share how really common some of these things can be. And I'm wondering if we can start to kind of break a couple of them down. So one of them that you mentioned is the erectile. You didn't say dysfunction.
You can say it. So you can say ED. Better to say ED. Yeah, I
So
said difficulties, but ED. Yeah.
yeah, yeah. And so could you kind of break down if someone is struggling with ED, perhaps maybe I think oftentimes a question that comes up is like, at what point do I know that this is kind of a problem? Like maybe starting there and then walking us through a couple of steps to take or considerations to look at if this is something that a man is experiencing. Let's be real. Your skincare routine probably consists of splashing water on your face and calling it good. But if you want to show up as the confident, put together man that you are, it is time to level up. The Skin Ultra Advanced Kit from Manscaped will give you everything you need in one simple system. We're talking 4 products that actually work. An electric face buffer pro that deep cleans your skin in only 60 seconds. An exfoliating face wash with brightening vitamin C serum that handles that post-shave irritation. And a lightweight moisturizer that won't leave you looking like a grease ball. Look, you guys, over 12 million men trust Manscaped, and there is a reason for that. This isn't some complicated skincare with a million steps that your girl is invested in every single morning and night. This is a straightforward routine that only takes a minute, and it will make a real difference in how you look and feel. So get 15% off the Skin Ultra Advanced Kit with code NAKED15 at manscaped.com. That's 15% off your entire purchase with code NAKED15 at manscaped.com. Your confidence will thank you.
A guy knows when his penis isn't functioning correctly, right? Yeah, and a guy knows. He knows that, there's a certain period of time where he's able to get that erection with arousal, right? There's a certain rigidity that he might have when he's starting to have intercourse. There's a certain rigidity that he knows that he should be maintaining while he's continuing to have intercourse, right? So for the most part, I think most men know if they're being honest with themselves, but sometimes it's a partner saying, "Hey, listen, like, before you might have been like an 8 out of 10 or a 9 out of 10, and recently you've been having to stuff it in. What's going on? Is there an issue?" And sadly, if it's a female partner, oftentimes they think it's their fault, which isn't correct, right? And which kind of catapults the issue even further because now the guy feels guilty that he knows it's his fault, but now his partner is kind of feeling bad about it, So, um, so when should they seek help? It's I think when they first realize that they're having some problems. I think that we know that ED for some men, not all men, but sometimes it can it's kind of the first thing that we see for other medical problems that they may have in the future. So it's important to kind of get on top of it early, and for guys, I think that at least they should start talking to their primary care doctor and say, "Hey, listen, my penis isn't working. Like, I used to be a rock star, and it's just not. It's not acting like it used to be. And so, and then from there, like if they come to my office, we do a full workup in terms of what it could be, what other issues that they might be having, that maybe this is a kind of a precursor of what's to come.
Mhm.
And so, we do a whole hormonal workup, we do ultrasounds, we do nerve testing, we do a bunch of things to make sure our guys are safe. Because at the end of the day, even though, I'm helping them with their penis, I want to make sure that, overall that they're healthy. I'm a physician first, a general physician first. I'm a urologist, um,
Could
but
you
even
share what some of the what that might be a precursor of?
yeah, of cardiovascular disease, heart disease, that's a possibility. That's usually the more common things, any kind of vascular issues. Um, could be an issue with testosterone or hormones. Um, it could be a neurological issue. We've picked up a couple neurological issues for our guys. It could be a result of like trauma that they might have had. Like it might be a Peyronie's disease, which is kind of curvature of the penis. Um, sometimes guys get into like a more of adrenaline mediated erectile dysfunction, and that's where, because they've had issues in the past, they just kind of get built up, and the adrenaline builds up, and they get into this like sympathetic kind of system, and it's just really hard for them to break out of it. So there's a number of things that we look for to kind of figure out like what is your problem,
Mm,
in particular. So we really dive deep into that, and we have a good time doing it. It's part of it. Part of my job is really trying to get guys to feel comfortable and feel like they can, be a little bit vulnerable, or all, or vulnerable all the way, whatever it might be, but where they can really talk about their issues and how it's affecting their lives.
mhm,
I've had a bunch of guys cry about the issues. I have a bunch of guys that kind of respond a little differently when it comes to this, but nobody's happy about it. As a guy, it's like you're not happy when one of your best friends in life doesn't work, and when he leaves you or holding you, kind of
mhm,
holding you captive a little bit.
Okay. Yeah, so thanks for sharing that this could be a precursor for some more, I mean, equally serious and different medical conditions. So they come in, they do some tests, maybe perhaps figure out what is uniquely unfolding for them if this is happening. Is there anything, I think that a lot of times, like the solution could perhaps be pills. I don't know if like, what is it? Cialis? Is that what it is?
OCLs, yeah, I mean,
Yeah, like are medications like that kind of like a first start or like what?
I don't know. I mean, I think it depends on what the problem is. After you kind of figure out what's going on, sometimes guys, that will be the first step. Either they go to their local like pharmacy, or they get something over the counter, or they go to the gas station and they get like this superhuman male penis pill or something like that. I've
Do
seen
those
some.
actually work?
I've seen some good. Well, most of them actually have Cialis and Viagra in them.
Mm,
So they do work, but it's just the doses are very sporadic, so you don't really know what you're getting.
mm,
And if you are taking other medications, you got to be really careful because you can have an interaction.
okay.
So you got to really be careful. Not everything over the counter is safe. Everybody wants to be on something that's natural, right? So they'll go to the gas station, or they'll go to the over the counter somewhere else, and they'll think it's natural, but it's really just Cialis or Viagra. So you might just go to your pharmacy or something, like, or talk to your physician if that's the route you're going to go, and get something that is probably a little more potent, that's going to be a little more consistent than the stuff that you get from the grocery store
Mm,
or from the gas station. So that those are the things. But for me, it just depends on what the guy's interested. If he's interested in getting his own natural erections back, then we do some regenerative things, some restorative things that will help them kind of get their more blood flow to their penis if that's their issue, and they can have more natural erections. Or, for some guys that want like a quick fix, then Cialis or Viagra might be an option for them.
yeah.
So really, like, once again, it depends on, the motivation of the guy, depends on their degree of ED, like how severe it is. If it's
Mhm.
really mild, oftentimes you can get guys off their meds so they don't have to take it anymore, or what have you. So it's a little complex than just taking a pill. I mean, but that is the first step for most people.
Okay. Yeah. Yeah. And I'm wondering, if someone is having, say, like weak erections, are there any, lifestyle modifications, or you mentioned like wanting things to be natural that a man could implement into his life today?
Yeah, I mean, I think that everybody should be thinking of eating healthier. Like the better your diet, the better your penis, really.
Mm-hmm.
I mean, if you're eating like a solid diet, then your penis is going to be at its max. It may not solve the issue, right? But there is a progression when it comes to ED. Things do usually get worse, so it's going to slow down that progression a lot. So, um, and it may help with treatment in the long run. So being heart healthy is really being penis healthy.
Mm-hmm.
The best, if you're getting good blood flow to your heart, then your penis is going to be really, really happy about that, and it's going to function as well as it can.
Yeah. Yeah, I love that. If your heart's healthy, your penis is happy. And yeah, because I've heard, like natural foods like beets help with erections, and I know there's like theories about pineapple influencing like your
Yeah, I mean, there are
sperm and
things
things like
that
that.
yeah, there are things that increase your nitric oxide levels, like beets do. There's other foods that you can eat that can help.
Mm,
Help to do that. And so that might be something that you want to do like on a daily basis. Like you can have a beet salad or have some beets in like your food, and it can help a little bit. It usually doesn't cure the issue, but it might help if you have like really, really mild ED, then it might be able to kind of give you a harder erection. So say you're maybe a 9, it might make you like a 9.5 or something.
mhm, mhm,
So those are things that are good. And once again, they're also good for the heart, right?
mhm,
So those are foods that you can eat that might help you. Exercise is great. Lifting weights is good.
mhm,
Getting that testosterone up with that naturally and like increasing your growth hormone with lifting weights and everything. So those are really good. But just like living like a really healthy lifestyle if possible, like doing some resistance training, some cardio, those are things that a lot of guys should do anyway. But if there's a motivation that your penis will get harder, why not? Everybody's gonna
Yeah.
do it,
Yeah.
right?
Yeah.
Got a penis.
Okay. And so that's ED. Can we look a little bit at PE, premature ejaculation, or like early ejaculation? And what can a man do if that is something that he's experiencing?
Yeah, so rapid ejaculation, as I mentioned, is it's very common.
Hmm.
I would say that probably most guys sometime in their life probably had it.
Hmm.
At some point, maybe they were in the back of their car with their girlfriend in high school and they got too excited or something like that, or their partner kind of surprised them and they're like, oh, they're wearing a sexy outfit or something, male or female, whatever it is. And all these problems, men that are having sex with men or having sex with women, it doesn't matter, like guys can have it, right? So like rapid ejaculation usually happens, like one of the definitions is that it's ejaculating before 2 minutes, but we see a range. We see guys that used to ejaculate in 10 minutes and now they're at 5 or 4 and they're really feeling some distress about it.
Hmm.
So distress is really important. If a guy says he's like doing it at 20 minutes and he wants to go to 40 minutes, I'm like, well, that's not really premature ejaculation. You're just being greedy. But yeah, so that's the most common issue. For guys, it can happen like from the first time they have intercourse until they're like 45, 50, 60. It can be a lifelong, or it could be something that is occurred like after having really good sex at a fairly good time, and then they just kind of happens to them.
Mm,
For those guys, we want to make sure that there's not any like issues with hormones or thyroid or anything like that. We want to make sure they are getting a firm erection as well,
mm,
just because like if you're having some ED, we do know that if you have an ED, then you may have associated premature ejaculation because of the ED, right? So that could be it.
mhm,
Or you could just have it, just be having it and still have hard erections. And, there's a number of different treatments for that. One of the first things guys try is probably like a spray, like a numbing spray that might be able to allow them to last a little bit longer. I always tell guys if we're going to do that, then make sure you wipe it off. If they're having like oral sex or something like that, you don't want your partner to have like a numb tongue. We don't want to do
yeah.
that. Um, So numbing sprays, they work pretty good for a lot of guys. And
Mhm.
then like, there's a theory on serotonin, and increase in serotonin may help it. So sometimes it's like an antidepressant of some sort. Um, for certain cases, you can use some other medications that kind of work on like dopamine receptors and opioid receptors. So some of those medications can help. Sometimes we'll do like I do a lot of penile filler, so I make guys' penises bigger, when they want it. And sometimes when we do that, they'll have it's a little decreased sensation in their penis,
Mm.
and they can kind of be helped with that. And some other things we do with like Botox and some other things that can be helpful.
Okay. So there's a lot of potential medical solutions to work with improving duration of
Yeah, it's interesting.
erection.
Where I said before that when a guy has ED, like the rate of their partner feeling guilty about it and that it's their fault is pretty high,
Mhm.
right? It's like, if it's a female or even a male partner, you know, then they kind of feel like they're not attractive to them anymore. They might be cheating on them or something like that. But for premature ejaculation, it's always the opposite. It's always that, not always, but oftentimes it's the partner saying you're just kind of being selfish. You're just trying to have your orgasm and just have me hang out. So it's sort of the opposite. It's interesting, but in both situations, it's not the patient's fault. It's really not. It's what's happening to them because something's not right with their body, not right with their penis or their ejaculatory system. And so sometimes we just needs a little alteration and
Mhm.
for things to kind of, a little kind of jump start to get going.
Mhm. Mhm. Okay, so that's PE and like on the other end of the spectrum would be delayed ejaculation. And what often causes that and what could a man do if he is in that situation where he's going and going and going and not able to reach that ejaculation when he is
It's
desiring
funny.
to?
It's funny. I never see a young guy that's got delayed ejaculation. It's always the older guys. Like
Mm.
the young guys are like, listen, my doc, I'm trying to go as long as I can. Like, I don't want to stop. I got to prove myself. And as you get older, like, oh, 5 minutes is enough. Like, I'm done. I just want to be finished. Go to sleep. No, I'm joking, but yeah, delayed ejaculation is an issue, if you're and once again, it's if you're used to going a certain time and then you're going much longer, then it could be a problem for you. In general, the definition is like give or take around 20 minutes or so. That's kind of one of the definitions of delayed ejaculation. But if you're a guy that used to go a minute and now you're going, 9 minutes, 8 minutes, maybe it's too long for you. There's a lot of reasons for delayed ejaculation. Sometimes it's a sensation issue. Sometimes it's a hormonal dopamine issue. Sometimes it's a hormonal issue like your testosterone or your thyroid or something else going on. Sometimes it's a relationship issue. I have a guy that he can ejaculate with his girlfriend, but when he's with his wife, he can't do anything. So what's going on there? So and sensation for the penis is really strange. I always tell my patients like, all right, what you think feels good, maybe not, right? And it depends on sometimes an emotional connection or a connection with that person. Like for instance, like if you hold somebody's hand, right? So um so say you hold one of your parents' hands, right? And you guys are walking, it's just like it's your mom, it's your dad, it's just like nothing, right? But then you have a partner and you hold their hand, right? And you're like, this is kind of I'm feeling warm inside, and so it's different. So sensation is so different, and it's sensation's different for the penis too. Sometimes depending on the partner, or sometimes depending on what they might doing, it could affect the ejaculation.
Mm.
So we do nerve testing, but I tell guys, even if your nerve testing is normal, sometimes it's the person you're with.
Interesting.
Um, Sometimes guys who have delayed ejaculation, we have a couple guys that have like a unorthodox masturbation habit. Sometimes guys they'll rub their penis while they're like lying flat on the bed. They're face down on the bed and they rub their penis. We see a number of those guys after some time may have some issues with delayed ejaculation, occasionally premature ejaculation, but mostly delayed ejaculation just because of the way they're kind of they responded to masturbation at such a young age and they're just not getting that friction or that sensation when they're with a partner. So there's like everything else, I wish that it was so easy that we just like you come in and I have the same pathway for everyone. I'm like, I'm gonna do this, this, and this, and it's gonna work for you, and I'm not gonna have a problem. I guess that would be good, but I guess I'd be out of a job because anybody will do it. But we're really complex as humans, and there's so many things that affect us sexually and emotionally, and some of those things, like I said, are hormonal. Some of those relationship issues, some of them are like what else is going on in our life, right? And habits and maybe bad habits we picked up over time, or it could be just like a medical issue that's causing it, like you got hypertension and you got high cholesterol and you smoke and your penis doesn't work, and that's probably the reason why. So it really depends on the individual in
Yeah.
terms of coming in, and the treatments vary. I always try to get guys, especially for their erections, I always try to get them to have their natural erections back. So we have protocols to do that. There's a number of things we do for that, and it really helps.
Mhm. Yeah, I appreciate that you mentioned some of the like the masturbation habits or practices that how that could influence the way that intercourse or sex with another person ends up being if your body is so used to doing things a certain way. I know sometimes there's components where maybe someone is like going really hard, really fast, like really firm. And so when they step into a sexual exchange with someone, that same level of sensation isn't there anymore. So
Yeah,
looking
that
at
intensity is not there.
how can you adjust your masturbation in a different way so that you actually increase your sensitivity in time? Is
Yeah,
what
I
it
think
sounds like you're
communication
describing.
with the partner is really important.
Hmm.
And really depending on that partner is like, saying what you like and saying what you don't like. I
Hmm.
always tell my patients, especially going into relationships, whatever your idiosyncrasies are, like you like somebody to like tickle your big toe. I always say, you got to say that on the first, not the first date, but like you got to say that early. You got to like put it out there because it's really hard to do it when you've been married for 5 years and you say, tell your partner, like tickle your toe. And she's like, or he or she's like, what are you talking about? Who are you seeing? Like, why is this new? And it makes them feel uncomfortable. So I always have my guys or my women, because I see a lot of women for sexual dysfunction as well. I just tell them, I'm like, listen, put your wish list out there. It doesn't have to be the first date, but when you're intimate, be like, this is what I like,
Hmm.
right? And what do you like? And then you can see if you're sexually compatible or not. There's some people who are like, if something's really important to you. I have a guy that I don't know how PG or you know
Go
uh,
there.
I have a guy in my office, and he's like, I have to be able to put like my finger in like the anus of a woman. Like, I don't know what it is. He's like, I have to be able to do that. That is like my thing, right?
Hmm.
And so he was with this girl, and like she wouldn't let. She was like, no, this is like an out. Like it's the only thing's going out, and he's just like he had to like break off after some time because he just couldn't. That was his thing.
Hmm.
One of the most interesting patients I had was this is a guy that's like 90 years old, and he was coming in for some erectile issues. And his first sexual experience was looking at magazines, right? And he was looking, this is back in the day. There's no internet. There's like no, this is just like magazines. And in those days, he was saying that, they were somewhat covered, but the ones that really turned him on was the ones with a woman smoking a cigarette. They had to have a cigarette. And from the time where he was reading those magazines to like the time he's 90 now, he can't have sex without somebody smoking a cigarette or the smell of cigarettes. It's so, so that was his thing. Yeah, I don't know if it's healthy. His lungs are probably pretty bad, but you got to know your thing and you have to be honest and you got to be able to talk to your partner about it. Or
Hmm.
you're just not gonna, or you're gonna be going somewhere else maybe, or you're just not gonna be happy with the relationship.
Yeah, I really love that you're sharing that. I think that especially for anyone that's out in the dating space, I think so often people are looking for compatibility and like life values and interests and hobbies, or do our lives collide? And one of the things that I think is equally important is figuring out, are we sexually compatible as well, not just like compatible in the relationship and like the interactions and what we like to do, but what do we like to do in the bedroom? And is that something
Yeah,
that we're
I
interested in
agree.
exploring together?
Or will you work with me? You know, it's like, are you gonna
Yeah.
work with me or not? Like, or it's one thing. It's okay to have different experiences and like, but it's another thing to be somewhat, obviously everybody's got their no, like whatever that no is, you got to be true to that no. But
Mhm.
maybe, we can work with something that might be close, and so those are things that I think it's obviously all the things that you mentioned before. Are you compatible? Do you have like life goals that are similar or whatever it might be? But I think this is also important, and I think that it should be talked about. Not the first conversation. I mean, you may look like somebody that's strange, but at some point early on, I think it's definitely something you should talk about.
Mhm. Yeah, and I remember I had a guest on a while back specifically looking at erectile dysfunction. And one of the things that he mentioned was how often many of his patients, one of the reasons why they were having this ED struggle was because they had a fantasy or a desire or a style of sex that they felt shame around asking for or bringing to the table. And so, because of that, that was one of the kind of impetuses to the problem that they were facing in their
Yeah.
performance. So,
I think that definitely can happen. I think, but when you look at ED, I think, and we're talking sort of like about these like red herrings, like,
mhm,
but the most common reasons for ED is it's usually because of like other medical conditions. It's usually because of the fact that the guy's got high blood pressure or because of smoking. Like smoking is horrible for your penis, like horrible. I always think
is that the same for vaping? I know I feel like in America,
we don't
cigarette
have
smoking
the
is
yeah,
less,
we don't have the
but
data behind vaping yet.
yeah.
We just don't, but I'm gonna think that it's going to be somewhat similar, but we don't know what it is. I can't really tell you. There's no
Mhm.
great studies, but in my mind, I'm sure it's like reducing nitric oxide levels of some sort and getting into the blood vessels. But there's no large studies to show that. So I can't ever say that at this point, I can't say that it's a direct correlation, but I would say like, like, what are you doing? It's if it's a possibility, it's going to hurt your penis, and why even start?
Yeah. Yeah.
Um, but these are the things that are so common, like guys that have issues with their hormones or any of these medical diabetes, it's huge. Like you get
Yeah.
diabetes, most likely you're gonna have ED.
Yeah,
Those
and
are
actually
some of these.
those were two things that I wanted to ask you some questions about. One was first like just hormones in general and looking at testosterone because it seems like there's almost like testosterone replacement therapy centers all over the place now. It's like so common. And I'm wondering, like, is there like a gauge for what actually constitutes low testosterone versus normal, like age-related changes? And I guess like how can men distinguish between medical need and like this cultural messaging that perhaps is out there right now about
What do you
going
mean?
to get that testosterone?
Testosterone will cure the world and like cure all your problems?
Yeah.
Of course it will. No, but yeah, so there's a lot of these like testosterone centers that are out there, and I think some of them are good. I think some of them are horrible. I
Mhm.
think that a guy has to understand that usually when a guy has ED, they think it's first of all, it's their testosterone, right? That's what they usually think. But when you really look at, what's out there, I would say probably like 18%, maybe 20 at most percent of guys, their ED is due to their testosterone. So that's like the majority of guys, it's because of something else, right? But when you hear this stuff on the radio, like, oh, it's gonna give you virility and it's gonna make you like, be able to, climb Mount Everest and all this stuff but a lot of that is it's not true, right? And I think it can be helpful. It can be helpful if your testosterone is low, right? It can be helpful if you're symptomatic from your testosterone. But those are the things that you have to try to figure out. So testing is important. There's a lot of these labs that, or these centers that'll just put you on testosterone without even checking your blood work, right? They just assume, or, some of it's like profit driven. And, I'm okay with, we live in a society where it's okay to be able to make money, right? But I think if you're going to do it, you have to make sure you're doing it ethically and you're not putting anybody at risk. Those are the things that you have to do. But in terms of like guidelines, so the guidelines, which I don't agree with all the guidelines to be honest with you, but the guidelines are like if your testosterone's less than 300 and you have to have two morning testosterone levels, and you should be symptomatic. I don't agree with and I don't agree with the number so much, right? But I do agree with that you should be symptomatic. Like you should have some problems.
Can you
You
describe what some
should,
of those symptoms might be? Like if someone
yeah,
is
so some of the
wondering if
symptoms
I,
are like fatigue, decreased well-being. Um, it could be low libido. It could be erectile difficulties. If it's really, really low, you can have some problems with fertility. It could be some depression as well. Maybe you're not making as much muscle mass in the gym that you used to. You know, those are the most common things of low testosterone. But there are also common things of like just depression, right? You could be depressed and like, man, I don't feel good. Like, I don't want to go to the gym. I don't want to have an erection. I just want to, kind of sit there. It could be um, side effects of maybe you're not sleeping at night, right? You have COPD or you have COPD. Say you have sleep apnea
Mhm.
and you're not sleeping at night and you're waking up. So then you're going to be fatigued during the day. You're going to be tired. You're not going to have the virility. You're not going to want to go to the gym. There's other things that can also give you those symptoms. So the key is to match up like those symptoms with levels of testosterone. And I don't agree with the 300. So I'm with some people with that, but you want to be smart about it. When I use like numbers, I use them as gauges. That's it.
Mhm.
I don't say this is what your number should be because in the reality, everybody's different.
Mhm.
And so I would tell people like if your physician, if his only goal is to get to a certain number of testosterone, then I think he's missing the boat. I think there's other things you should be looking at. You should be looking at, like, is it symptomatically making you better? Right? For some guys, they come into my office and say, we said 300 was the number, and say they're 300 or 299. Let's say they're 299, and they feel great. They're like, oh man, like, mentally, like I got no brain fog. I just won like the chess championship. Like, I look at my partner and I want to jump on over all over him or her. Like I just ran a marathon. My penis is going great, but my testosterone's 299, so it's low. So
Mm.
like, should I get on testosterone? The answer is probably not, right? Because I'm going to give you testosterone and it's not going to make you feel any better because you already feel pretty good, right? And there's no data, at least with certain levels, that it's going to affect like how long you live and like what are you going to do with your life. There is data to show if it's really low. When you look at guys, there's some papers out there to show that if it's really low, that people may die a little bit sooner of all-cause mortality, but it's got to be fairly low, and it's not at that three. It's much lower than the 300 point.
Well, and
Not
and
to get
I'm
too
wondering,
scientific, but
yeah, no, I appreciate that. And I know this is a question that has come up before in this conversation is looking at if someone is taking testosterone replacement, what are the long-term influences? Let's say that they stop taking it. Does their testosterone deplete? Has the body like forgotten how to produce it itself? Like what
yeah,
happens
yeah.
if they start to titrate off of this?
Yeah, so when you take testosterone, your testicles don't make testosterone anymore. They get small, they get what's called atrophy. And if you come off it abruptly, then then you won't make your own testosterone. You're gonna feel miserable. So there's ways to take people off it. Like we don't ever take anybody off it. We always we kind of start stimulating the brain and everything to start working again.
Mm.
But I think if you need testosterone, it doesn't matter if your testicles don't make enough anymore. If you need it, you need it, right? If your
Mhm.
body's not making it, then it's not making it. You got to supplement it.
Mm.
We don't have the ability for you to, I mean, well, there are. medications that we use that will stimulate your own natural testosterone, right? And they work a little different from testosterone. There's a whole group of things that we use. But if you're talking about testosterone and you're on it, then yeah, your body's not going to make it, and then you're going to have to be on it forever.
Mhm.
But that's okay, I think. If you're not making it, then you're not making it, right?
Yeah.
You have to supplement it.
And I know back in the day, probably not that long ago when like taking steroids was, I mean, it still is a thing, but like just thinking back about when people were taking steroids and like having hair loss and like changes in skin and acne and things like that, is that the same case with testosterone replacement?
So testosterone is a steroid.
Hmm.
So it is a steroid. So um, it's just a steroid that's legal, right? But it's a steroid. I mean, it's the
Yeah.
same. I mean, the other anabolic steroids have different properties, and they act a little differently in the bloodstream, and then when it gets into the brain and the penis and the muscles and everything. But they're all steroids. Um, yeah, so when you're administering testosterone, you can get some. I say acne is probably the most common out of all of them.
Mm.
Hair loss I find is fairly rare if you know what you're doing. If your levels are going really high, then you may have some hair loss or some thinning. But I don't really see that, to be honest with me, or maybe all my guys are already bald. No, I'm joking. No, but I know I'm honestly, but I don't usually see that. If you keep your levels like where the goal is really to find the sweet spot where, guys are feeling much better, right? But you're
Mhm.
not going crazy with your testosterone.
Yeah.
Right, because I know that no matter how much testosterone I give, after a certain point, it's not going to make a difference. Once your receptors are saturated, then you can give 10 times the amount. They're not going to feel any better. They're just going to have more side effects,
Mm.
right? And so you want to find the sweet spot for that patient. And that patient's sweet spot might be, 301, right?
Mhm.
Right? Because they may be saturated at 301. It might be 500, it might be 900. I don't know. So it's one of those things is when you do it, you got to make sure you're doing it correctly. And that I just think that when your doctor starts number hunting, then I think you got to find another doctor, right?
Mm.
Because they obviously don't understand like the complexities of testosterone, how it works, the side effects that you see. I had a guy that went to one of these testosterone centers, and his testosterone was like through the charts. The lab couldn't even like it was like greater than 2,500 or something like that. His estrogen was like through the roof. It was like almost like 95 to 100. And I was like, man, we're in trouble. And then we talked about some things to do. His hemoglobin was like really high. And he ended up having, like, he left my office. I didn't put him on anything. He ended up having a stroke.
Oh,
So
wow.
this is not something that, people should really think is like something that, if it's done incorrectly, then it could really hurt somebody.
Mhm.
Obviously, that's an extreme example, but there's a lot of extreme people that are out there. And I think people have to, just be conscientious of who they're getting it from. Sometimes they do a lot of these online pharmacies, and it seems like all these online pharmacies are somehow in Florida, and they're like just cranking out testosterone. And
Yeah.
like I said, I'm not the person that's saying that if you do a good job, when you said you're studying to be like you're going to be a certified sex therapist. I think if you're the best sex therapist in the world, then you should be able to charge whatever you want. I do believe that.
Mm.
But I think that you got to have a good product, and you have to make sure that you're not like hurting people. Like, you're not just doing it for the money, but you're doing it because that's your value,
Mhm.
you
Yeah.
know? But I don't think but a lot of people are doing it because it's easy. They're just throwing stuff out there, and they're really hurting a lot of people,
Mm.
which I
Yeah.
think is wrong.
Well, I appreciate that I like you mentioning this element of it isn't just about the number. And it makes me think about how, the BMI used to be such like a marker and an indicator of somebody's kind of, are you in a healthy weight or not? And it didn't ever take into account muscle mass versus fat mass. And
Yeah,
so
of course.
people are thinking they're obese and they're jacked. So just looking at the reality that a number isn't going to tell you exactly what's going on in your body, and they're really more used as like as you described a gauge, which I think is helpful, especially if someone listening is going to one of these clinics and is look or going to a doctor who's just looking at the number. That's really, really helpful to have that information. And you mentioned this piece a while back about someone having diabetes and the influence that that can have on sexual health. And I with, there's like the rise in this like Ozempic medication usage. And I'm wondering, how do these GLP-1 agonist medications influence a man's testosterone levels? And just, is there anything from your experience that you think should be taken into consideration if someone is on one of these specific medications?
Yeah, Ozempic makes your penis look bigger, which is a good thing, right? I mean, it makes you
Really?
lose weight, right? It makes you lose weight. You lose some of the peripubic fat, which is surrounding your penis, and you lose in weight, and guys feel better with it. But seriously, there's been one paper about Ozempic, and it's a urological paper that came out maybe like 6 months ago, and it showed that with Ozempic, there's about a 1%, and it's really low. 1% or 1.4 or 1% of patients may have some erectile dysfunction or other sexual problems, right? So it's 1.4%. So it's really low
Okay.
when you're looking at sexual problems. So we don't think that that's a cost. At least that's just one paper, but we'll see. And Ozempic has a number of positive effects, I think, right? So there's already been shown to show some cardiovascular benefits and all these other things. But, for a guy, it's like, all right, now like I lost all this weight. I feel sexy, right? Guys can feel sexy too. I got a little more confidence, right? Um, the one thing about Ozempic, which you have to pay attention to, is there's some people that do have some muscle wasting. And I find the people that have a little more muscle wasting with Ozempic, they talk about like the Ozempic face and all that other stuff. Then you got to really watch their hormones. Sometimes their testosterone may dip because they lost the muscle, because muscle is gonna, like, when you're building muscles, can increase your testosterone a little bit. So I think those are the patients that I really, really look out for, that are on Ozempic, which has the muscle wasting. But losing weight is great. And then what we know about is I'm definitely not someone that's negative towards Ozempic. I mean, everything that I've seen is actually more positive than negative. Obviously, there's side effects of Ozempic. There's like the gastrointestinal side effects. You get some nausea, some diarrhea, and stuff like that. And there's some people that can't take it, especially patients that have had like some pancreatic issues and certain type of cancers. But outside of that, for what we know now, I think it's a great drug, and I think that it does a lot for people. It does a lot for people that that are having a hard time with losing weight themselves, right? Or they may have diabetes. Sometimes I'll couple the Ozempic with like some testosterone if they're losing more kind of muscle mass as opposed to fat, like a fat to muscle mass ratio, then we may help them with testosterone, especially if we see their testosterone levels going down, just to kind of help with that, to avoid some of that muscle wasting. So there's a number of things you can do, but I think Ozempic is great. I think it makes your penis bigger. I think it gives you, I'm joking, but it does.
So does
But
it actually make your penis
no, no, it's the
larger or just
appearance. It's the
look?
appearance. It's the
Okay.
appearance. I'm
Okay.
joking, but it's the appearance. I
Hey.
mean, I'm sorry. It's one of my like sexual medicine stuff. Like when guys come to my office, we just laugh a lot. But yeah, the appearance of it makes them feel sexy. Like, it's nothing like being able to, women aren't the only creatures on this world that get to feel sexy. Guys want to feel wanted, right? Guys want to feel like when they put on a shirt that it fits them properly. When they go on the beach, they want to, if somebody's looking at them, they're like, all right, I got a little more
Totally.
self-confidence.
Mhm.
So all the women out there, when you see your guys naked or something like that, tell them how good they look, right? It's really important for men. Um, so the long answer is, yeah, I think Ozempic is fine. I think that when you look at the data, there's only like what we know now is only 1%. There's a lot of other health benefits that we're finding for Ozempic, but I think that it's a new drug. So I always caution that. I always think that we have to continue to look at the research. We have to continue to see what it's doing what's the long-term effect. And then from there, we'll kind of like say, all right, after it's been around for like 10 years, we can say, all right, this is like something that has been beneficial for the human race. But
Mhm.
we'll see.
Yeah, yeah. Okay, thanks for touching on that. And the last piece that I want to look at today with you is I know we've talked a lot about penises and erections, and an element that I think is probably equally important is prostate health and screening. And I know that, screening recommendations have changed over the years, but I'm wondering if you could walk us through the kind of the pros and cons of different screening approaches and like how men could approach this decision with their doctors.
Oh, I thought you were gonna. I thought when you said penises, I thought we were gonna talk about female sexual function. I was like, we need a whole
Oh,
hour to talk about that,
I mean,
right?
I would love to talk about that with you too.
I thought you were
Maybe on
gonna.
another episode. I know
I
you have a
thought,
lot
yeah,
about menopause and all the things.
yeah, I thought you
Um,
were gonna say vaginas next, and I was like, all
oh,
right, we can talk about that. So prostate cancer screening is, just the gist of it is prostate cancer screening is kind of gone from I finished my residency in urology in 2009. So there's a lot of like change since I was a resident, which I started in 2003, to like where we are now. In general, now it's about like having a conversation with the patient. We're screening a little bit later for men that have low risk factors. So if you've never had a family history, if you're white, but if you're African American, if you have a family history of prostate cancer, if your mom has a family history of breast cancer, then you're going to be screened a little bit earlier. For me, what earlier means for me, it's like 40. I'm going to check a PSA. I'm going to do a rectal exam. For everyone else, it's a lot later. But I'm just, I'm a guy that really likes more information. And so if I'm 50 and even if I have low risk factors, I'm going to ask for a PSA just because I want to have that number early, right? And the earlier you have it, the more of a trend you can look at, right? So if you get your PSA when you're 65 and it's a little bit elevated, you're like, all right, well, what was it when it was 40 or 30? Is it similar to that number? Maybe it's just more of a component of like benign prostate hypertrophy, which is BPH. So I like to have that information for most guys around 50, but you have to have the conversation and you say, listen, you're checking your PSA, which is a blood test. We may do a rectal exam, which I always do, but some guys don't want it and I'm fine with it. And it may end up you having an elevated PSA, and we may have to do a biopsy, and the biopsy may show that you don't have prostate cancer, but you just had a biopsy for no reason, and there's risks to biopsies. So that's the thing, that's the conversation that you kind of have to have. But if you're an information guy, which I am, and if I have no risk factors, I want my PSA at least at 50. If I'm a high risk guy, I'm African American, family history of prostate cancer. If I was somebody that had a family history of breast cancer, then I'm going to want to get that early, just to have that information. So that's kind of the nuts and bolts, I think, of prostate cancer and PSA.
okay.
Um, and the recommendations, like I said, we were at the point several years ago where we weren't checking hardly anybody. Nobody was doing checking PSAs. And we found that when you're not checking PSAs, that we were seeing more and more like more deadly prostate cancer that we were kind of figuring out and finding a little bit later, right? So then we went back to now checking PSAs. Um, it's the most common male cancer outside of like skin cancer, right? So it's something that most guys are going to get, but not most guys are going to die of. So you want to make sure that if you do have it, if it's like a low grade prostate cancer, then maybe you just watch it. All right.
Okay.
So I'm gonna
Yeah.
leave it. I'll leave it at that. I'll just keep talking, and I'm gonna put you to sleep soon. So
No, no.
I'm gonna,
And well, one of the things that I've really been picking up from what you've shared is recognizing that a number isn't black and white and how really individual every person's body is, even from, the prostate cancer screening numbers to your testosterone levels to the duration that you can maintain an erection. Like all of these things are really going to be individualized. And so I think that just shows how important it is for everybody to be aware and understanding of their own body and not just looking at something and making a blanket statement. Is there anything else as we close out here today that you think is really important just for a man to have either in the back of his mind or for him to take action on or to implement into his life to really have great sexual health?
I think that, I mean, it's kind of the boring stuff, right? The boring stuff really allows you to live longer. It allows you to like have your penis stay up longer, have better erections, all these other things. It's the boring stuff that really pays the dividends, you know?
Hmm.
Like if people invest in like if they invest like, you know, the reason I say this because my last guy was like a financial guy. And so if they invest just like a little bit every day, right? They close their eyes in like 30 years and they're like, damn, I got a lot of money, you know? And it's the same thing. It's like you invest every day in your penis and your heart health, but he also like in your like your other parts of your body, like your stress levels and all these other things, like your mind, all those things are so important. And then at the end of the day, like you look back and you're like, damn, like, you know, like, and I'm like, I'm healthy when I compare myself to my friends that are 70 or 75 years old. I'm like walking around where these guys are like in wheelchairs and they're doing other things, you know? So it's like an investment that it's a boring investment that you're making like every single day, right? And the body's like, you know, I'm trying to go back to that piano. I'm trying to think of something with that piano in the back. And like, you know, it's just like, um, I can't do it. I was trying to figure out how I can relate this erectile dysfunction to the piano, but I can't.
Well, what comes to my mind is thinking about how, like, in order to learn how to play, usually you have to practice your scales first, like moving up and down the keys on
Oh,
the
I like
piano, and
it.
how boring that is. But if you do it, playing music is so much easier and so much more fun and enjoyable because you don't have to worry about it or stress about it or think about it. And perhaps that is kind of
I
the
love that.
analogy
I love
to
that. Like that
this.
practicing. And you know, I didn't want to do that, so I can't play the piano. But you're absolutely right. It's really the practicing every day. And I guess at the end of the day, you want to like sing that, you know, want to play that Marvin Gaye song, you know.
Mhm.
What's the Marvin Gaye? It's like sexual healing at the end of the day. Like that's the goal. And when everybody's 90, if you're playing that song, then you did okay. You
Mhm.
know, like you really want to be able to preserve your sexual function as long as you can. And that's the boring way of doing it. Everybody wants a cheat code, and there's hormones and other things that could be incorporated in that, you know. But you got to do the boring stuff. Like you got to eat the right food. You can't smoke. You can't like do this crazy stuff that's going to really affect your body, you know. So that's the key to sexual health. I wish I could say, well, I have this product here that's gonna get you there, you know. I'm still looking for it, but it's the boring stuff as of right now. And if you are having a problem, you know, it's not gonna get better on its own. You can mask it with going online and like you know, going to these websites and getting like Cialis and Viagra. That's just a mask. And at the end of the day, you really want to make sure you're going to somebody that cares about you and that just doesn't want to sell you a medication. You want to go to somebody that's really gonna, you know, gonna where you're gonna find value and is, you know, somebody really looking in deep and trying to figure out what's going on and trying to help whatever those problems are. You
Mhm.
know, so that's what I would say. I think.
Yeah,
We'll
beautiful.
see.
Thank you for sharing that. Yeah, so taking the small, mundane but necessary actions every day to really invest in your sexual health and making sure, I loved how you shared that if a man has a problem with his penis, he knows. And so if you're listening and just take that step forward and see the doctor. And it sounds like you have a lot of fun in your office and find a way to make the experience almost like not so heavy. And so I appreciate you coming on the show and sharing all of this knowledge with us and opening the door for someone who might be in a place of recognizing and acknowledging I do need to go see somebody to get some help on this. So thank you for being here.
Yeah, thanks for having me.
Thank you so much for tuning in to this episode of The Naked Connection. Be sure to subscribe so you don't miss another episode. Trust me on this, your sex life and that special someone in your life will thank you for it. And if you really love the show, please take a moment and leave a 5-star review or a written review and let me know what you think. It would mean so much to me and this show. Until next time, happy connecting.